This video is presented by TRACS WA, Training Centre and Subacute Care. This scenario depicts the therapy session of 70-year-old transtibial amputee Norm. Senior podiatrist Janine Robertson from Sir Charles Gardner Hospital is on hand to provide advice as well as treatment if needed.
Morning, Norm.
How are you?
I'm fine, thanks. Come on through. How are you keeping?
Yeah, no, it's pretty good.
At the podiatry clinic, Norm's foot is assessed for any problems or changes in condition. The aim here is to facilitate early detection of any issues as well as providing ongoing education.
Under many circumstances, that second limb becomes a lot more vulnerable, so it needs to be carefully maintained. Amputations can occur for all sorts of reasons. Some people might lose it in a limb in an accident. Some people might lose a limb as a result of a cancer or some other reason. But a lot of people lose their limbs as a result of a complication from diabetes or vascular disease or some other medical condition that puts the limb at risk at the best of times. If it's the remaining limb, there's statistics that show people are much more likely to lose that second limb, so looking after it becomes even more important. Any problems with the foot?
No problems at all.
Nothing you're having any issues with? Oh, that's great. So you're still getting everything checked regularly?
Yes, I do. I have the foot checked every couple of days by the silver chain.
Fantastic. And you're seeing your podiatrist regularly?
And I'm seeing a podiatrist every 6 to 8 weeks,
Good.
yes.
Okay. Basically what I want to do today is just, I guess, give it a once over, check that everything is still okay. And certainly with your diabetes, you've obviously lost that leg.
Yes.
But you're much more at risk of problems with this leg, so we need to be a little bit of extra careful with it.
Yeah.
Do you have any problems with cramps or anything like that?
No, not cramps. It's swelling, but not cramps.
Bit of swelling, okay. And when do you have this problem with the swelling?
No, by the end of the day, it's quite late. Even with the stocking on, which helps considerably, it does quite large, but overnight it reverts back to normal.
Okay, so it goes down overnight. I'm just having a feel of your pulses, just to see what they feel like. Good. And what I'm going to do is I'm going to have a little listen to your pulses as well, just to see what we can hear.
This is a type of ultrasound.
It is a little ultrasound. Okay. Again, so that's a really nice strong pulse. That sounds great.
Okay.
There we go, lovely clear pulse. That's good.
Oh, that's good.
So that tells us that, or indicates to us that the blood vessel's coming down to your foot. You're getting plenty of blood flow down there. There's certainly nothing to suggest from looking at your skin or anything like that that there's any problem there. One more thing I'm going to do is I'm going to try and take a blood pressure measurement of this toe, because this one's quite large, and it's really just an additional check. So let me try this little cuff. So what it's doing is just looking at the little tiny blood vessels that come down to your toe.
Okay.
And it just gives us a little bit more idea of how that circulation's going. Oh, family. Bit fiddly with this one. Oops. Now, as I said, you know, your pulses are nice and clear. I don't have any concerns about the circulation. This is just an additional check,
Yeah.
and there's no ideal pressure level for it. But
Okay.
what we don't want to see is the blood pressure
Too
or even
low.
get too low.
Yeah, no, I understand.
Okay, let's see how we go with this one. Yep, we got quite a high reading, 200 millimetres, but overall, even if we don't get a reading, I'm pretty confident that your circulation there is good. There's no other signs. In turn with the diabetes, you can have a separate issue, or sometimes they occur together, of the nerves being damaged. And you were telling me before that you had needles in your foot and you didn't actually feel that they were putting needles in. So our concern is when the sensory nerves are damaged, it's called peripheral neuropathy, that you won't feel either injuries or something going on with your foot. Leave it and it will become more complicated from there. Okay, so what I'd like to do now is, we're fairly confident that the sensation to your foot is not 100%, but I'd just like to do a check and just establish that for ourselves. Now to do that, what I'm going to use is this little bit of fishing line, and you can sort of see when I bend that, okay, and there's a certain amount of pressure required to bend that. It tells us that if you can feel that with your feet, that amount of pressure, the sensation's intact. If not, we start questioning whether the sensation is normal in the foot. Can I check that on your hand first?
Sure.
And you don't have any pins and needles or numbness in your fingers? No. Okay. Can you feel that bit of pressure on your fingertips?
Yep.
Okay, so what I'm going to do is I'm going to ask you to shut your eyes. I'm going to press this on different parts of your foot, and I'd like you to tell me yes or indicate in some way if you feel that same sensation that you felt on your fingertips. Okay, nothing there at all?
No, nothing.
Okay, basically it confirms that you're not feeling things normally, you've got peripheral neuropathy. The result of that is that if you trod on something or injured yourself, you might not notice it. So what that means is it's really important to check it regularly, and if you can't see it, because I know your vision's not 100%, getting someone to do that for you.
Yep.
Also to remember that if you can't feel with that foot, it affects your balance as well. So you've noticed that?
It has, when I've got out of the car or something like that with the, and I put both feet down, if I'm not looking, and I just do it, and I might be on the curb or something, and I could tend to fall over. Yeah.
Okay. Everything seems to be working, everything's in really good condition, we just want to keep it that way.
Okay.
It's really important.
Thanks, Jo. Yeah.
Okay, great. Thanks, Norm.
TRACS WA would like to thank the staff and management at Sir Charles Gardner Hospital for their involvement in this project. This project received funding from the Australian Government.